Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaj. Last moment before the NEET PG exam happens every year because there should be a last moment, right? But if you know what the examiner wants, what are going to be the topics, issues, clinical cases in the real NEET PG exam, you may read a lot of theory, but ultimately applying all that theory, all those high yield facts into the context of the clinical case vignette to answer the questions about the next investigation, what is the diagnosis, what is the treatment of choice, image-based questions, clinical vignette-based questions, you must be fully ready. So that is the whole purpose of Sprint 19. There are 1,000 clinical case vignettes. Nice to see Dr. Devendra Manusuri. Very nice to see Doctor. Already 10 online classmates. Please inform to all your friends on the Telegram, WhatsApp, and all the groups. Don't forget to like this video broadcast and go to the Learnograph and download the Sprint 19. So Sprint 19 is part of 30 Sprint series. Sprint 19 to Sprint 48. Every sprint has around 1,000 clinical case vignettes, and these 30,000 clinical case vignettes will cover all the 19 subjects. If you take the actual NEET PG paper or fmge or NICET, nowadays 95% of the questions are all clinical case vignette, based on which you should know what the buzzword you need to pick up to answer correctly. Nice to see Narayana Swami, Syed Asrar, and many more who are all online. Dr. Pratyusha, good doctor. So let's make the great beginning, doctor. So yes, once you go to learnograph.com, I left the link below this YouTube broadcast, learnograph.com. You get the Sprint 19 ebook. So just pay $500 and download, and you have all the 1,000 clinical case vignettes, from which at least 20 to 30 MCQs straight away are going to come in the tomorrow's NEET PG, I guarantee you. All right, so let's make the great beginning, doctor. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Can you please punch? Is the voice loud and clear for all of you? Yeah, right. So the 1,000 clinical case vignettes for the NEET PG, this is ebook 1 of the 30 ebooks. Thank you for the feedback, Rajesh, Syed, Anwar, everybody. Yes. So this is one of the 30 PDF books out of the 30,000 clinical case vignettes most tested in the exam. This is the list of the clinical case vignettes. The total 1,008 clinical case vignettes are there in this sprint book, Sprint 19. So let us quickly finish as many as we can in the tomorrow's exam. Right now, can the online students can punch? Is the size of the font is okay for all of you? Please quickly punch. So these are the no-nonsense study material. You know, there are many coaching centers which give 4,000 pages, 5,000 pages, unboxing of the material and all that. It's impossible to do a revision. Ultimately, you need to know what are the common clinical case vignettes examiner is going to ask you. What are the common high-yield facts? What are the 1,000 most common topics that you need to be ready with? Khali topic का नाम मालूम हुए तो टॉपिक का नाम मालूम हुए तो that's more than enough for you to become the winner to guess the correct answer in the tomorrow's NEET PG exam, doctor. So let's make the great beginning. Can you please punch whether the font is comfortable for all of you, or shall I increase the font? Please let me know. Now, developmental dysplasia of the hip, one of the favorite questions. How will they ask? 1 month old female presents asymmetric thigh fold. It's called Galeazzi's sign. An ultrasound of the hip confirms developmental dysplasia, and we use Pollock harness to treat developmental dysplasia. That is, congenital dislocation of the hip is what you need to basically remember. So font size, you want it bigger font? Font size decreases. You want me to increase the font size or decrease the font size, doctor? Please update me. Okay. Diamond Blackfan anemia. 1-year-old child with pallor fatigue, craniofacial abnormalities. There is a macrocytic anemia with a low reticulocyte count. That's how the congenital red cell aplastic conditions present. One of them is Diamond Blackfan syndrome, is what you need to basically remember. Cryptorchidism. 1-year-old child, absent right testicle in the scrotum. Ultrasound is the investigation of choice. And what is the treatment, doctor? Orchiopexy. And one of the important things you need to know is undescended testis is a risk factor for the development of the testicular carcinoma, is what you should remember. 10-day-old newborn, bilateral eye discharge and swelling, conjunctival injection, purulent discharge, conjunctival swab confirms chlamydia trachomatis. You should remember neonatal conjunctivitis due to chlamydia trachomatis is something that you need to basically remember. Sir, you decrease your font size. Words are skipped from sides. Okay, all right. Basically, if you download the PDF, doctor, by going to the learnograph.com, automatically you will get, it's easy for you to parallelly follow with me the discussion, right? So I left the link below, right? Now, crown rump leg. A 10-week-old pregnant comes for the first prenatal visit. So in the first trimester, how do you reliably confirm the gestational age? Crown rump length is the one which is most specific and sensitive and accurate, is what you have to basically remember. A 10-year-old boy presents with a dog bite on his hand. Physical examination reveals puncture wounds surrounding erythema, and the wound is cleaned, prophylactic antibiotics. So animal bites and clinical management, especially rabies. How do you classify the various stages of the rabies is a favorite area for the examiner. A 10-year-old boy with a fever and swollen lymph nodes after being scratched by the cat. What do you call this? Cat scratch disease, which is Bartonella Huxley, is the organism, one of the favorite questions. 10-year-old boy with a history of asthma, allergic rhinitis, atopic dermatitis. There is a bilateral wheezing, nasal polyps, and eczema on the flexural surface. Eczema on the flexural surface is a very important clue for the atopic triad of atopy, is one of the favorite questions of the examiner. Nasal polyps, eczema on the flexural surface, bilateral wheezing, allergic dermatitis, allergic rhinitis, atopic dermatitis, you should remember. 10-year-old boy rapidly enlarging jaw mass, it reveals lymphadenopathy, physical examination. Laboratory show high levels of LDH. Biopsy shows starry sky appearance on histology. What is your instant answer in the tomorrow's NEET PG, doctor? Burkitt's lymphoma. 10-year-old boy with abdominal pain starting in the periumbilical area, migrating to the right lower quadrant. He has fever, nausea, vomiting, classical of appendicitis. Always, what is the rule in appendicitis, doctor? In appendicitis, the rule is, if there is hunger, if the child is hungry, unlikely to be appendicitis. Anorexia is the rule in appendicitis. No appendicitis child will have hunger. If hunger is there, means it is not appendicitis. A very important principle which you need to basically remember. A 10-year-old boy with a headache, vomiting, ataxia. There is a papilledema, gait instability. MRI shows a well-defined mass in the cerebellum. What's your diagnosis? Pilocytic astrocytoma. You should know how to recognize pilocytic astrocytoma radiologically on the MRI. One of the favorite questions of the examiner. 10-year-old boy with honey-colored crusted lesions around his mouth. Today only go back to the Google images and look for how the golden honey-colored crusted lesions of the impetigo looks like. One of the favorite questions of the examiner. 10-year-old with recurrent nasal bleeds. 10-year-old boy with recurrent nasal bleeds, easy bruising, normal platelet, prolonged bleeding time. Further testing shows a deficiency of von Willebrand factor. What is your diagnosis, doctor? Von Willebrand disease. Von Willebrand disease. What is the role of the von Willebrand factor? Von Willebrand factor stabilizes the factor 8. Factor 8. That is the reason. Factor 8 instability, degradation will lead to prolonged APTT. At the same time, von Willebrand factor is required for the platelets to adhere with the vascular endothelium. That's the reason, even though if the platelet count is normal, still the bleeding time is prolonged because of the dysfunctional platelets. So both the clotting time prolonged and also bleeding time prolonged. Both APTT prolonged, also the bleeding time prolonged. Classical of von Willebrand disease. Von Willebrand, Glanzmann's thrombasthenia, Bernard Solier. Definitely one MCQ is going to come in the tomorrow's NEET PG exam, doctor. So very nice to see. Pratyusha, excellent. This is how we need to do, doctor, a revision. Keep on punching the answers, your points that come to your mind. That is the whole purpose of the last moment revision with Dr. Murali Bharadwaj with the sprints. So Devendra is saying, sir, 500 रुपए बहुत expensive हो रहा है PDF के लिए. Let me tell you, doctor, there's a lot of crap of material available. Every coaching center will try to make you very knowledgeable, extensively knowledgeable. But let me tell you a simple fact. Unless you are laser sharp focused, finished 10,000 PYQs revision, know all the 30,000 clinical case minutes examiner is going to throw on you, then only you can comfortably crack the exam. So what is important is not extensive, unnecessary material in the study material. How brief it could be, how you can revise, that is most important. So this 30,000 clinical case minutes, every PDF has 1,000 clinical case minutes, is all that you require to become the winner in the tomorrow's NEET PG exam. So that's the reason, slightly expensive, I agree, but not as expensive of those mindless face-to-face classes, crash courses and all that. It is not really that expensive. I'll try to give a push to you by discussing 100 to 150 clinical case vignettes. Then another 3-4 hours you should sit with your friend. Download the PDF and share with 2-3 friends, no problem. The same 500 can be shared between 4 or 5 of you, no problem. But sit, discuss together common clinical case scenarios which are going to come as an MCQ in the tomorrow's NEET PG exam, doctor. Now, continuing our journey, so once more, I like to tell you that please like this video, share this video in all your social media groups, write your comments below the video after the video class is over. Write in the comment box. That will help us to make this viral without much of advertisement and waste of money on advertisement. Our students are our brand ambassadors. 10-year-old boy with Tourette's syndrome is started on haloperidol to control his tics. He presents with rigidity, bradykinesia and tremor. So bradykinesia, rigidity and tremor, what do you call? Parkinsonism. This is a drug-induced Parkinsonism. So what drug which is used to control the tics in Tourette's syndrome lead to drug-induced Parkinsonism, doctor? Haloperidol, because haloperidol is dopamine antagonist is what you need to basically remember. 10-year-old child with headaches, visual disturbances, growth failure, there is a cystic mass in the cellular area, cella turcica, with calcification. This is what exactly examiner is going to ask in the tomorrow's NEET PG exam. Very nice to see 24 online classmates. Very good, doctor. हम बहुत खुश हैं. So in the remaining 7 days, I am going to come more often than one time to spend time with all of you people. Very good, Pratisha. Supracellular area, craniopharyngioma. 10-year-old with circular scaly rash on his arm. Examination shows well-demarcated erythematous lesion with a central clearing. Skin scraping, KOH preparation shows fungal hyphae. And what is the diagnosis? Tinea corporis, which is also called ringworm, is what you need to remember. 10-year-old chronic itchy, red and dry skin, particularly in the flexural areas. There's a lichenified plaques in the antecubital fossa. He's prescribed corticosteroids and emollients. What's your diagnosis, doc? Classical of atopic dermatitis eczema is what you need to remember. A 10-year-old, frequent temper tantrums, arguing with adults, refuse to comply with the rules. And their typical diagnosis is oppositional defiant disorder, which is in borderline with juvenile delinquency. At one point of time, we believe our parents are wrong. But when we become parents, we remember and realize how reasonable they were. That is the transition of everybody's life. Right now. Now, a 10-year-old male with intense itching, especially in the night. There's a rash on his hands and arms. There are burrows. Burrows is the keyword. Burrows and excoriations. Skin scraping shows the mites treated with permethrin. What are the conditions? Scabies. 10-year-old male with painless rectal bleeding, no abdominal tenderness. Technetium per technate scan shows an uptake in the lower right abdomen. It is a mcqs diverticulum, is the classical clinical vignette. 10-year-old male with history of asthma presents with increased wheezing and nighttime cough, started on cromolyn sodium for prophylaxis. So asthma is an obstructive lung disorder, just like COPD, just like the emphysema, bronchitis. Asthma is also obstructive lung disorder. So asthma prophylactically is managed with the cromolyn sodium is what you need to basically remember. Right, doctor? Good. Very nice to see. Just now, around 8 students purchased the Sprint 19 1008 clinical case vignettes, from which easily 20 to 30 MCQs ditto in tomorrow's exam, guaranteed. Doubt it's nahi hai. Right? Now, a 12-month-old boy presents for a well-child clinic. He can stand independently and say mama and dada. So that is what is expected in a 12-month-old. So developmental milestones, every NEET PG you go, 1 MCQ guaranteed, doctor. 12-year-old boy with a history of motor and vocal tics presents with involuntary utterances of the obscene words. What is this called? Coprolalia, which is the feature of the Tourette syndrome, where there are vocal and motor tics, is what you need to basically remember. Very good. Another 6 students just now have downloaded by paying 500 rupees each this Sprint 19, the last moment revision, 1000 clinical case vignettes. So there are totally 30 Sprint ebooks I am going to upload, covering 30,000 clinical case vignettes, from which 200 by 200 questions are going to come, 100% strike rate, doctor. Keep following me. Alpha-2 agonists in Tourette. A 12-year-old with Tourette is prescribed the clonidine to manage his tics. He presents with fatigue, dry mouth, hypotension. So these are all the side effects of the clonidine, which is alpha-2 agonistic agent. You know, clonidine is also used to treat the hypertension. Once more, if you use to treat hypertension, especially refractory hypertension in the renal failure patients, typically chronic kidney disease patients where hypertension is very severe, clonidine is the only option available. Clonidine is a favorite drug for all the nephrologists, is what you have to basically remember. Now, doctor, multiple motor and vocal tics that interferes with the daily life. Started on haloperidol, which improve the symptoms. So haloperidol is the drug which is a dopamine blocking agent used to treat the Tourette syndrome. A 14-year-old short stature compared to his peers. His growth velocity is normal. He has a delayed bone age on X-ray. Delayed bone age. They are called late to bloomers. Constitutional growth delay is called late to bloomers. 9th class, 10th class, they are still 5 feet. Suddenly in the 11th class, they become 6 feet. That's called constitutional growth delay. What is the characteristic thing about constitutional growth delay? If you take the left wrist X-ray, you will find delayed bone age on X-ray is what you have to remember. Once more, what are the conditions where bone age is delayed? Bone age is advanced. Everything you should know. 15-year-old boy with hematuria, progressive hearing loss. His father had similar symptoms. Developed end-stage renal disease by the time he is in his 40s. Very classical clinical vignette on Alport syndrome. You should be ready for the tomorrow's exam. 15-year-old boy, lack of secondary sexual characters, bone age is delayed compared to chronological age. What is your diagnosis? Constitutional delay of growth and also puberty. 15-year-old boy, progressive difficulty in walking, frequent falling, dysarthria, loss of proprioception, and his sister had it, another sister also had it. Family history is there with the similar symptoms of difficulty in walking, frequent falls, dysarthria, cerebellar dysfunction, loss of proprioception. You will need to think about Friedreich's ataxia is what you need to remember. Classical clinical story. 15-year-old with progressive muscle weakness, cough, pseudo hypertrophy. Classical feature, doctor. Dystrophin gene mutation is there. which is very classical of Becker's muscular dystrophy. 15-year-old with primary amenorrhea, virilization, clitoromegaly, absence of breast development. And the laboratory test reveal elevated testosterone levels and low estradiol levels. So this is a classical example of congenital aromatase deficiency is what you need to basically remember. A 15-year-old female with Tourette syndrome started on tetrabenazine. What is this drug? Whether haloperidol, tetrabenazine, they're all dopamine depleting agents. If you have too much dopamine, you will get dyskinesias, etc. If you have too much of depletion of the dopamine, it leads to echinesias. So that's a whole problem to strike a balance between dyskinesias, which are hyperkinetic movements treated with the dopamine depleting drugs, which can lead to drug-induced Parkinsonism with bradykinesia, is what you need to remember. 15-year-old history of aggressive behavior, truancy, destruction of the property. So this is an example of a conduct disorder, classical clinical vignette. 15-year-old with sickle cell disease presents with a sudden onset of severe anemia and there is a low reti count. So sickle cell patients can go into aplastic crisis. There will be vasospastic crisis, aplastic crisis. You should know all types of crisis in case of sickle cell disease. Very nice to see 26 online classmates. Today we are all studying together. So please don't forget, doctor, to like this video. Nice to see Madhu, Maddie, and many more who are all online. So don't forget to like this video, share this video on your Instagram, WhatsApp groups, everywhere. And please write comments after the session is over. Write your comments. Don't forget to go to learnograph.com. I left the link below. There you have Sprint 19, the ebook PDF, where all these 1,000 clinical case minutes are present. At least 20 to 30 MCQs in the tomorrow's NEET PG, straight away from this. So totally this is the ebook 1 of 30 ebooks. Totally 30,000 clinical case minutes. That is all that you need to master, to face the NEET PG. Once upon a time, NEET PG was an exam of single liners. No more. Examiner wants you to be clinically good, clinically sound, at least clinically imagine the clinical case scenarios, just like USMLE, and come to the exam. So, doctor, let's continue. Now, 16-year-old, multiple blackheads, whiteheads on the face, open and closed comedones, topical retinoids are prescribed, is classical of acne. 16-year-old, primary amenorrhea. There is no pubic hair. Normal breast development is there, but no uterus. No uterus. And upper vagina, only blind ending pouch-like vagina is there. Karyotype अगर देखें तो 46XY, serum testosterone are elevated. That means typically there is a androgen insensitivity, karyotypically male, but androgen insensitivity, androgen is produced but it is not able to act on the receptor responsible for testicular feminization syndrome is what you need to basically remember. All this excess testosterone get aromatized into estrogen because once you have estrogen, you will develop breast. Whether karyotype is male or female doesn't matter. If you go to liver disease, why do they develop gynecomastia in male with liver disease? Because liver is needed to metabolize estrogen. If it is dysfunctional, too much of estrogen will be there, and that leads to the development of gynecomastia in liver failure patients. Similar logic. Androgen insensitivity syndrome also. All that excess testosterone become aromatized into estrogen is what you need to remember. Very nice to see another 15 students just now purchased the Sprint 19 PDF of 1000 clinical case vignettes. Now, a 16-year-old girl needs surgery. Who must provide the consent? Consent is one of the favorite questions. Her parents or the legal guardians. 16-year-old girl, crampy lower abdominal pain, especially during menstruation. The pain starts just before her period and it lasts for 2 to 3 days. Classical clinical story. It is called primary dysmenorrhea is what you need to remember. A 16-year-old girl, absence of menarche. She has normal breast development but no pubic or axillary hair. Her karyotype is XY. So it is a classical story of androgen insensitivity syndrome. Externally they look like girls, but karyotypically testicular feminization syndrome, androgen insensitivity syndrome, karyotypically they are XY is what you should remember. 16-year-old male, tall stature, severe acne, normal physical development, there's an extra Y chromosome. So what is this called? XYY syndrome. 17-year-old girl, fever, sore throat, lymphadenopathy, atypical lymphocytosis, positive heterophile antibodies. What is your diagnosis, doctor? Infectious mononucleosis is what you need to remember. Epstein-Barr virus leads to infectious mononucleosis where positive heterophile antibodies will be there. It is also called Kissing's disease. 19-year-old, history of restrictive eating, presents with severe weight loss and amenorrhea. There's a cachexia, lanugo hair, hypokalemia, hypomagnesemia, ECG show QT prolongation. What is your diagnosis, doctor? It is anorexia nervosa with complication of malnutrition is what you need to remember. 2-month-old female for routine checkup, asymmetrical thigh-fold, ortolani, Barlow's maneuvers are positive. It is classically congenital hip dislocation. A 2-month-old infant is brought to the emergency after an episode of apnea, color change, limpness, and it has resolved spontaneously. Now the infant is well. What is this called? Apparent life-threatening event in pediatrics. You should know how to recognize. So Barlow maneuver eliciting a palpable clunk indicating hip instability is the feature of developmental dysplasia. In a 2-month-old infant, what is the schedule of the DTAP? 2, 4, 6, 15 to 18 months and 4 to 6 years. A 2-month-old with brief episodes of cyanosis, apnea, limpiness that resolve spontaneously. So what is this called? Brief resolved unexplained event. BRU is what you should know. 2-month-old infant with continuous murmur. The buzzword is continuous murmur. And signs of heart failure, classically called patent ductus arteriosus. How do you treat? Indomethacin. Prostaglandins keep patent ductus arteriosus patent. But indomethacin, anti-prostaglandin, closes the PDA. A 2-month-old infant with cyanosis and difficulty feeding, there is a loud murmur, clubbing. Echo shows tetralogy of Fallot. So always remember 4 T's that lead to cyanotic heart disease. T for TOF, T for tricuspid atresia, T for truncus arteriosus, T for transposition of the great arteries. You need to be very, very sure about. Similarly, TAPVC, total anomalous pulmonary venous circulation, any of them. Now, if you look at these 5 T's in top leading to cyanosis. T, the tetralogy of Fallot, T, the tricuspid atresia, both of them lead to decreased blood flow to the lungs. That's the reason there is a pulmonary oligemia. Whereas P, the truncus arteriosus, P, the transposition of great arteries, P, the total anomalous pulmonary venous circulation. The remaining 3 T's, they increase the pulmonary blood flow, leading to pulmonary plethora. So tomorrow's NEET PG exam, they will give you a radiograph with either pulmonary plethora or pulmonary oligemia and ask you to identify what could be the possible cause among these 5 T's for this given case of cyanosis. You must be very, very sure about. 2-month-old failure to thrive, palpable bilateral flank masses, ultrasound shows enlarged echogenic kidney. Classical presentation of autosomal recessive polycystic kidney disease. 2-month-old with hypotonia, upslanting palpebral fissures, single palmar crease, protruding tongue, trisomy 21. That is equal to Down syndrome. 2-week-old vomiting, dehydration, failure to thrive, ambiguous genitalia, hyponatremia, hyperkalemia, elevated 17-hydroxyprogesterone levels. So the most common cause leading to the development of congenital hyperplasia is 21-alpha hydroxylase. But this is a case of salt wasting congenital adrenal hyperplasia. You need to give glucocorticoid and also mineralocorticoid replacement therapy. 2-week-old infant presents with bilateral eye discharge and swelling. Gram stain show gram-negative diplococci is the gonococcus. 2-week-old persistent jaundice, lethargy, deep jaundice without hepatosplenomegaly. There is unconjugated bilirubin which is elevated. So this is an example of glucuronyl transferase deficiency, which is called Crigler-Najjar syndrome type 1. Because of that, there is a elevated unconjugated bilirubin is what you need to remember. A 2-year-old is able to stack the blocks, use 2-word phrases, follow simple instructions. Classical cognitive developmental milestone. You need to make your own list and be ready for tomorrow's exam. So very good. Already we finished 57 high-yield facts in the form of clinical case vignettes, doctor. Like that, you have to sit with your friend, at least one very good friend, with whom you need to do the revision fatafat, doctor. Now, 2-year-old child, delayed motor milestones, there is a spasticity, scissoring gait. MRI show periventricular leukomalacia. That means white matter changes are there around the ventricles. This is the classical picture of cerebral palsy. Today only go and check in the Google images how periventricular leukomalacia MRI looks like. 2-year-old child with delayed motor milestones, spasticity, intellectual disability. There was a premature birth, low birth weight. Classical story of cerebral palsy. 2-year-old child, episodes of breath holding, cyanosis during the temper tantrums. All these episodes are self-limited and resolve spontaneously. So what are these called? Breath holding spells is what you need to remember. So how do you want to treat the breath holding spells is a favorite question of the examiner. 2-year-old, pelor, growth retardation, hepatosplenomegaly, microcytic anemia, elevated HbF, fetal hemoglobin levels. What is your diagnosis, doctor? Cooley's anemia, which is beta thalassemia major. So typically, once the beta chain of the hemoglobin is defective, what is the normal tendency of the body. Skip the beta chain, which is defective, and try to produce more gamma chain. Alpha 2, gamma 2, hemoglobin F levels become elevated. 2-year-old received pneumococcal conjugate vaccine. So, pneumovac is a part of the modern vaccination schedules. 2-year-old is walking, talking, and social interaction. So you should know the different developmental age milestones in pediatrics. Every NEET PG you go, one MCQ is going to come. 2-year-old girl comes with a limp. One leg is shorter than the other when the knees are flexed to 90 degrees. This finding is called Alice sign, which is classically seen in developmental dysplasia of the hip. A 2-year-old barking calf. Stridor is there. Inspiratory stridor and retraction of intercostal space. Neck X-ray shows steeple sign. Steeple. Church ke upar hota na steeple. That's very classical of laryngo, bronchitis, which is viral, and it is treated with nebulized epinephrine and corticosteroids. Once more, this viral bronchitis, which is called croup, and the epiglottitis, which is due to the H influenza. You should know how to differentiate, which is an indication for intubation and emergency management. You need to be very, very sure. Epiglottitis versus croup. Today only go back and then do the revision. 20-year-old with a history of sickle cell disease with severe pain in the lower back and legs. Pallor, jaundice, normocytic anemia, increased red count. Peripheral smear shows sickle cells. This is an example of a sickle cell vaso-occlusive crisis. Severe pain in the lower back and legs because of the vaso-occlusion is what you have to remember. 20-year-old college student, headache, fever, neck stiffness, elevated lymphocytes in the CSF, normal blood glucose. Normal CSF glucose, only mildly elevated protein. So whenever CSF has elevated lymphocytes, it's a sign of aseptic meningitis. 20-year-old with large oval scaly patches on her trunk. There's a generalized rash of smaller lesions, classical of pityriasis rosea. It is very self-limiting. Pityriasis rosea, herald patch, Christmas tree pattern of the lesions, all these buzzwords. You must be ready for the exam, doctor. 20-year-old, frequent episodes of binge eating following self-induced vomiting. There is a dental erosion, parotid enlargement, hypokalemia, classical of binge eating and purging disorder. 20-year-old, recurrent episodes of binge eating followed by self-induced vomiting, dental erosion, parotid gland enlargement. There are calluses on the back of her hand. Roussel sign it is called as. Classical of bulimia nervosa is what you need to remember. So one of the classical cases of bulimia nervosa is shown in the Crown serial, where in the royal family, Charles' wife has got bulimia nervosa. 20-year-old female presents with recurrent episodes of swelling of the face, extremities without urticaria. There is a non-pitting edema of the lips. C4 levels are low. C1 esterase inhibitor levels are decreased. Is classically called hereditary angioedema is what you need to remember. So, preparation for the NEET PG exam is not about ratta maro, batti maro, buri taraf ratta maro, wo sab bakwas hai. You need to be conceptual. You need to know what are the common clinical case vignettes, how to approach them. That is most important, doctor. कहां तक बट्टी मार सकते हो आप? स्टेचियम ट्यूब का लेंथ क्या है, यूरिथ्रा का लेंथ क्या है, स्पाइनल कार्ड का लेंथ क्या है. No need. Don't worry. Don't spoil your brain thinking that they will be responsible for your debacle in entrance. No, sir. If you look today's NEET PG, it is all clinical case vignette oriented. That's the reason you should know. What are the 30,000 clinical case vignettes examiner is expecting you to know? Whether it is ophthalmology, whether it is ENT or anatomy or physiology, anywhere, it is how you apply the high-yield facts in a clinical scenario. That is what examiner is expecting. So that's the reason, don't worry. If you know what are these 30,000 clinical scenarios, automatically you will get the seat. There is no need of रट्टा मारना, बट्टी मारना, बुरी तरफ मारना, अच्छी तरफ मारना, कुछ भी जरूरत नहीं है. What you need is, you need to imagine. See, when you read the topic of mitral stenosis, think a patient of mitral stenosis. The left atrium, left ventricle के बीच में क्या हो गया? Stenosis हो गया. Left atrial pressure increased. That reflected in pulmonary vein, and that led to development of pulmonary hypertension, which in turn will show an effect on the right ventricle. So that is how you need to imagine, right? If you get opportunity, talk to a patient of mitral stenosis. And today on YouTube, you have everything. Patients of mitral stenosis only are coming forward and saying that, "Bhai, ye mera 2D echo hai, jara dekh lo na. Ye mera kahani hai, sun lo na." So that is what patients themselves are coming forward. Today, learning is very easy because of the YouTube and all these tubes, right? So that's the reason. Be clinical. If you are clinical, you will crack the NEET PG. I can guarantee it. If you think it is a game of रट्टा मारो, बट्टी मारो, बुरी तरफ मारो, अच्छी तरफ मारो, ये प्लान से मारो, वो प्लान से मारो, it's all waste of time. You take any topper, your own friends are toppers. You ask them, how did you crack? They know what clinical case scenarios are going to be capsulated in the form of the MCQs and going to come in the NEET PG. Right, doctor? So you have the link below. Please write your comments how you felt helped out by this Sprint 19. Go to the learnograph.com, download the ebook, PDF, share it with 3-4 friends, no problem, and tell them that 30,000 clinical case vignettes Dr. Murali Bharadwaj is going to be presenting to you on the youtube.com/onlinembbs. Be part of my guests. I'm your classmate, roommate, benchmate, table-mate, every day holding your hand and inspiring you to become clinically thinking, to face a clinically oriented exam called NEET PG. आराम से पढ़ो. Last 1 week, अशांति से कुछ भी नहीं मिलेगा, चिंता से कुछ भी नहीं मिलेगा. निश्चिंता, निश्चलता, निश्चिंता, निश्चलता, ये दोनों प्रैक्टिस जो करता है वही टॉपर बनता है नीट पीजी का जिंदगी में. So, doctor, continuing our journey, 20-year-old peanut allergy, ingest the peanuts, sudden onset of wheezing, swelling of the lips, hypotension, reveals urticaria, angioedema. You have to give IM, epinephrine. Classically, this is an anaphylactic reactions clinical picture, which is type 1 hypersensitivity. 20-year-old male presents for a routine checkup. So how can you prevent sexually transmitted infections, doctor? Using the condoms. 20-year-old chronic cough, motivation, decreased motivation. He reports daily use of cannabis. So this is the classical presentation of cannabis abuse. 20-year-old with flank pain, hematuria, costovertebral tenderness. hexagonal crystals. The urinary cyanide nitroprusside test is positive. So this is a classical story. Cystine kidney stones. Every NEET PG exam you go, doctor, one MCQ is going to be there on the renal stones, different types of renal stones. 20-year-old itching, scaling between the toes, erythematous scaly lesions, fungal hyphae on KOH, classical of tinea pedis, athlete's foot, 20-year-old with pain and swelling in the right hand after punching the wall. There is a fracture on the fifth metacarpal neck. It's called boxer's fracture, is what you need to remember. 20-year-old with painful red blistered skin after a day at the beach, classical of sunburn. 20-year-old, recurrent episodes of non-pitting facial laryngeal edema, low levels of the C1 esterase inhibitor and low C4 levels is angioedema. 20-year-old with severe pain in his right shoulder after a fall while playing the basketball. There is a squared off appearance of the shoulder. Today only go to the Google images and look at squared off appearance of the shoulder, limited range of motion, classical of anterior shoulder dislocation. Once more, doctor, X-ray of the anterior shoulder dislocation, a favorite question of the examiner. Bulb sign, all these things you have to be very good with. 20-year-old with persistent feelings of being detached from his body and surroundings, describing them as unreal. He reports significant distress, impairment in functioning, classical of depersonalization or derealization disorder. 20-year-old, history of splenectomy due to the trauma. Now, he is advised pneumococcal, meningococcal, H influenza type B. So, whenever spleen is not there, that lead to decreased opsonization, that lead to capsulated organism infections. That's the reason pneumococcal, meningococcal, H influenza type B vaccines need to be immediately given. 20-year-old with a history of binge eating, self-induced vomiting, dental erosion, electrolyte abnormalities, bulimia nervosa. 20-year-old with an abdominal mass, elevated LDH, solid ovarian tumor. One MCQ invariably comes on ovarian tumors, endometrial carcinoma, cervical cancer, breast cancer, thyroid cancer, prostate cancer, colon cancer. Babuji, paper out. If you know what comes most frequently, ये कुछ डिफिकल्ट परीक्षा है क्या? नहीं है, not at all. If you have 12 months of internship, 10 months मस्ती करो, enjoy करो, गाओ, घूमो, happily treat the patients, go to hospital every day, do suturing, do venisections, do lumbar punctures, enjoy a little good time with the boys and girls. Great. 2 महीने मेरे साथ बैठो. I will exactly tell you what to focus to prepare for exam. You go to any entrance exam. मैं अब भी बोल रहा हूँ, आप लिख लो. 10 out of 200 कहाँ से आता? अब भी बोलता हूँ मैं. लिख लो फटाफट. पेन है क्या? पेंसिल है क्या? हाँ, लिख लो. Contraception, apoptosis, one monoclonal antibody, ECG in dyselectrolytemias, hypokalemia, hyperkalemia, hypocalcemia, MI, one ECG. Carcinoma ovary, carcinoma cervix, carcinoma endometrium, carcinoma lung, carcinoma prostate, breast carcinoma. कभी NEET PG एग्जाम होता क्या इसके बिना? Right? Congenital adrenal hyperplasia, Little syndrome, Bartter syndrome, Gentleman syndrome, renal tubular acidosis, type 1, type 2, proximal, distal. You should know the differences. Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. One question will be there. Right, doctor? So many times we think हमको बहुत मालूम होना है. No, there are hardly not more than 1,000, 1,200 topics. Babuji, 30,000 clinical case vignettes, which you need to master. Actually, you don't need to mug it all, let me tell you. See, when you suddenly have a notes with so many high yield facts, no, because once in 20, 30 years, it has been asked once. Just because it is being asked, हम उसको बट्टी मारने का कोशिश करें तो कहां अंत है, right? If you look at last 4 or 5 papers, one image based question on the parasitic ovacysts, you should know how to identify them. Kiska tail tapered रहता है, etc. Once upon a time, they used to ask invariably one question on snakes. Indians are snake charmers, right? So, सांप पकड़ने वाले हैं, समझते हैं, Winston Churchill when we got independence to India. So, snake, snake, snake without knowing snake. आजकल snake थोड़ा कम हो गया, honestly speaking. But still, cobra कैसे दिखता, Viperidae कैसे दिखता, which is myotoxic. See, snake is myotoxic. Najanaja is affecting nervous system. All these things, खेलते पढ़ सकते. You don't need a coaching program, you don't need an app, you don't need a plan A, plan B, or you don't need a crash course. You don't need to come to a location sitting with 1,000 people and waste your energy, peace, money, everything. What you need, 3, 4, it should be like a 3 idiot movie. 3 मिलके prepare हुए तो automatically you will win. And I am here to lead you into the path of winning, doctor. Yatra yogishwarah krishno tatra pardho dhanurtaraha tatra sri vijayodbhutihi, where the chariot called Krishna and a warrior called Arjuna go to the battle called Kurukshetra. There is only winning, but no less than winning. So that should be your preparation. You need to be focused. तीर लगा के मार देना, 200 क्वेश्चंस को एक्सपेक्ट करके हमला करना. Offense, not defense in the tomorrow's NEET PG exam. There's a dangal movie, right? So, doctor, let us in this last moment get ready with full audacity, with the hope, with the incurable optimism that we are going to be the winners. 20-year-old women, confusion, dry mouth, flushed skin, mydriasis after ingesting an unknown substance. She has history of depression. So all these features, confusion, dry mouth, flushed skin, mydriasis, they're all the features of anticholinergic activity of something that she has consumed is what you need to remember. Similarly, depression के लिए tricyclic antidepressants का amitriptyline like drugs are used. All these tricyclics never give it to treat depression elderly people because they lead to the development of all anticholinergic problems, like the bladder will not contract, the bladder will stagnate, there is a predisposition to UTI. All these problems are because of what? Amitriptyline is added with gabapentin and given for diabetic neuropathy in a elderly man who has a prostate enlargement with a bladder outlet obstruction is a disaster, is what you need to basically remember. 20-year-old women with intense fear of social situations, avoidance of public speaking. Very good. Another group of 12 students just now downloaded the Sprint 19 ebook from the learnograph.com. So please do visit learnograph.com and download the ebook, doctor. 20-year-old with intense fear of social situation, avoidance of public speaking. She experienced palpitations, sweating, trembling when exposed to social situations. What is this called? SAD. Social anxiety disorder, otherwise called social phobia, is what you need to remember. 20-year-old seeks emergency contraception after unprotected sex. So what do you offer? Plan B, levonorgestrel, and copper IUD. They are the two things which are preferred. 22-year-old dysuria, vaginal discharge, cervical motion tenderness. What is that called? Chandelier sign. Whenever pelvic inflammatory disease is there, if you try to do pervaginal examination, such a severe cervical motion tenderness will be there. The woman will kick you with her leg. You will go and catch the chandelier. So chandelier sign in pelvic inflammatory disease. Nucleic acid amplification test confirms chlamydia trachomatis, one of the very common cause for the pelvic inflammatory disease. 22-year-old female with fever, joint pain, pustular rash, swollen tender right knee, scattered pustules on the extremities, gram-negative diplococci on the synovial fluid analysis. She has a disseminated gonococcal infection, classical presentation with septic arthritis. 22-year-old wheezing, shortness of breath, chest tightness, history of exposure to triggers, dust and pollen, bilateral wheezing, chest X-ray show, hyperinflated lungs is classical of asthma. Asthma is reversible bronchoconstriction. 22-year-old agitation, paranoia, hallucination after using synthetic cathinone known as bathing salt. It's called bathing salt intoxication. 22-year-old considering a contraceptive implant. What is the common side effect of a medroxyprogesterone? I mean the progesterone derivatives. If you happen to take as an implant, irregular bleeding, headache and weight gain is what you need to remember. 24-year-old is preoccupied with perceived defect in her facial appearance. Though the friends are saying, boyfriend is saying, oh darling, your nose is so beautiful, your lips are so beautiful, your cheeks are so beautiful. She says, no, I look like Surpanaka. So she frequently seeks cosmetic procedures. All the money earned by her boyfriend is gone to support her cosmetic procedure. What is that called? Body dysmorphic disorder is what you need to remember. 25-year-old wearing contact lens, eye pain, redness, blurred vision, fluorescent staining reveals corneal ulcer. So typically contact lens, acanthamoeba infection can lead to development of keratitis. 25-year-old female with maculopapular rash after taking amoxicillin for sore throat. There is a widespread erythematous rash without any mucosal involvement. So there is a classical presentation of a beta-lactam side effect. 25-year-old painless, slowly enlarging nodule on the upper eyelid. It is firm and non-tender nodule. You have advised warm compresses. It is an example of chalagion. Today only go back to Google Images and review how a chalagion looks like. 25-year-old female with a serpiginous pruritic rash on her foot after returning from a trip to the seaside. Raised erythematous track on the skin. It is an example of a cutaneous larva migrans. And how do you treat? Ivermectin is the drug of choice. 25-year-old female with abdominal pain, diarrhea, weight loss, right lower quadrant tenderness, and cobblestone mucosa with skip lesions, non-caseating granulomas. They are the music to your ears. Crohn's disease is the answer. 25-year-old female with a itchy rash on her earlobes after wearing new earrings. Erythematous vesicular lesions on the earlobes. Patch testing is used to diagnose contact dermatitis. So commonly earrings ornaments contain nickel. It is the allergy to nickel is what you need to remember. 25-year-old female, fatigue, exertional dyspnea, fixed splitting of the second heart sound. That is the clue. Classical of AST, atrial septal defect. Once more, doctor. ASD, VSD, PDA, Eisenmenger syndrome. Today only you need to go back and do the revision. 25-year-old female with fatigue, pallor, jaundice, splenomegaly, positive direct Coombs test, spherocytes on the peripheral smear, autoimmune hemolytic anemia is there. And what type of hypersensitivity it is? Type 2. That is typically RBCs on their membrane having a fixed antigen. A free-floating antibody went and attacked it is an example of cytotoxic hypersensitivity type 2 causing hemolytic anemia. 25-year-old with a fever, headache, neck stiffness, positive Brzezinski, elevated WBC in the lumbar puncture, decreased glucose levels. So, CSF may normal glucose levels are a feature of viral meningitis. Hypoglycorrhea is the feature of bacterial meningitis. 25-year-old female with hives and itching after exposure to peanuts, urticarial wheals. Skin prick test. Prick test is used for atopy. So, atopic hypersensitivity. Patch test is for contact dermatitis. Don't forget. 25-year-old female with nausea, vomiting, right upper quadrant pain after ingesting a large amount of acetaminophen. There is a hepatomegaly, tenderness, elevated liver enzymes. So how do you treat acetaminophen toxicity, doctor? We give N-acetylcysteine to treat the acetaminophen toxicity is what you need to remember. Very good, Pratyusha. Very proud of you. So always the purpose of a teacher is not to teach, but to stimulate you to do the revision. जोश में पढ़ाई करना है. जब आप पढ़ रहे तो रोते हुए नहीं, डरते हुए नहीं. जो डर गया वो मर गया. So you have to feel confident, right? You have billions of cells in the brain. Hardly, not even 0.1% of the memory of the brain we use. If we use even 2 or 3%, we become Albert Einstein. So many gray cells are there in our brain. So don't be afraid. Don't tell me the story that I may forget. You won't forget. But at the time of reading, don't be passive. 3-4 साथियों के साथ बैठो, अच्छा समोसा ऑर्डर करो, गर्मा गर्म चाय मंगाओ, टेंशन लेने का जरूरत नहीं है, right? Sure, Pratyusha says revision series is very helpful. Very good. Thank you so much, doctor. And please go to learnograph.com, download this PDF. इसमें से 20 to 30 questions short to come, and I'm going to give you around 30 PDFs like this, totally 30,000 clinical vignettes, which is going to give you a complete 360-degree revision. 25-year-old female presents with painful genital ulcers and fever. She is on acyclovir. She returns with nausea, diarrhea, headache. So what are the side effects of acyclovir, doctor? GIT symptoms and headache is what you need to remember. 25-year-old with painful recurrent vesicular lesion on the lips. Examination shows herpes labialis. You have given oral acyclovir. Oral acyclovir. 25-year-old with palpitation, chest discomfort, rapid regular pulse, not irregular, rapid but regular pulse. Narrow QRS complex tachycardia. Always remember, wide QRS tachycardias, unless proven otherwise, are ventricular tachycardias. Narrow QRS tachycardias are typically supraventricular. So this is a case of atrioventricular nodal reentry tachycardia, AV and RT. So today only go back, review the ECG, AV nodal reentry tachycardia. So remember, doctor, there are 50 full-scale grand tests, each containing around 30 to 40 image-based MCQs, just like the NEET PG exam. 50 full-scale grant tests, right? And 200 explanations, each explanation containing around 10 high-yield facts in the form of mind maps. We published on the learnograph.com. So these 50 full-scale grant tests are all that you need for the practice. In our full-scale grant test, there's 50 full-scale grant tests. Once you are crossing 160 score, that means it is like a Chadwick sign that yes, you are ready for getting conceived with the postgraduate seat, right? So you need to know common clinical vignettes, common clinical case vignettes, standard topics examiner every time will give 200 questions from those 1,000 topics only. You should know what is that list and practice more than enough to become the topper. There is no rocket science in this, doctor. Now, 25-year-old with vaginal discharge, postcoital bleeding, physical examination show friable cervix, mucopurulent discharge. So, cervicitis commonly is because of chlamydia trachomatis, which is proven by nucleic acid amplification test, not is what you need to remember. Vaginal itching, thick white discharge, erythema, edema of the vulva, budding is pseudo-hyphae is equal to vulvovaginal candidiasis. Give fluconazole 200 milligram for about 5 days and the woman will thank you. Oh, doctor, tonight is gone. You are my hero, doctor, right? 25-year-old female, history of penicillin allergy, given a cephalosporin. Develops wheezing, swelling of the lips and tongue and hypotension, urticaria, decreased breath sounds, epinephrine given, anaphylactic hypersensitivity. 25-year-old female with a history of schizophrenia, immobility, mutism, posturing. She does not respond to external stimuli. Catatonia is what you need to remember. Once more, in schizophrenia, you should know what are the positive, what are the negative. Atypical antipsychotics are more effective to treat the negative symptoms. You need to be very sure. Once more, antipsychotic classification. What are the side effects of clozapine, agranulocytosis, etc. 25-year-old female with bulimia nervosa. She is prescribed bupropion, but the medication is contraindicated. Why? Because bupropion can cause an increased risk of seizures in the patients who have eating disorders, is what you need to remember. 25-year-old female with recurrent bacterial infection is found to have a low level of immunoglobulin. Flow cytometry reveals that there is a deficiency of mature B cells. What is this condition called? B cell deficiency disorder. 25-year-old female develops pruritic rash after exposing to poison ivy. So, patch testing, as in the contact dermatitis, is a type 4 hypersensitivity. Prick testing is done for the atopy, which is a type 1 hypersensitivity. You should know what is the difference between patch test and prick test very clearly. 25-year-old male, motor vehicle accident, abdominal pain, hypotension. So how do you evaluate, doctor? Fast scan will show free fluid in the abdomen. 25-year-old male brought to emergency after motor vehicle accident. What is the ABCDE protocol? Airway, breathing, circulation, disability, and exposure is what you need to remember. 25-year-old typically complains severe pain in the hip, shortened, adducted, internally rotated, classical of posterior dislocation of the hip, which is also called dashboard injury, is what you need to basically remember. 25-year-old male comes to the ER, abdominal tenderness, guarding. So typically blunt abdominal trauma, hemoperitoneum. How do you evaluate? Favorite question. 25-year-old male, repetitive hand washing, checking behavior, obsessive compulsive disorder. And what is the treatment, doctor? CBT, cognitive behavioral therapy is what you should remember. 25-year-old, stab wound, evisceration, signs of peritonitis. You need to take him emergently to the operating room, penetrating abdominal trauma management. 25-year-old male, abdominal pain, bloody diarrhea after eating undercooked chicken because he is not in kitchen. Stool culture show Campylobacter jejuni, undercooked chicken should ignite the chicken in your mind. 25-year-old male, bloody diarrhea, abdominal pain, penismus, left lower quadrant pain. Colonoscopy show continuous colonic inflammation, only limited to colon, is ulcerative colitis, whereas Crohn's disease will have skipped lesions. That's the reason from mouth to anus it can spread, is what you should remember. 25-year-old with difficulty falling asleep and waking up in the morning, leading to too much of excessive daytime sleepiness. Polysomnography is done, which shows delayed sleep phase disorder. So how do you treat, doctor? Circadian rhythm sleep disorder it is called. Treat with melatonin, treat with light therapy is what you should remember. 25-year-old with fatigue, easy bruising, nosebleeds, pancytopenia, promyelocytes or rods. It's called APML, acute promyelocytic leukemia. What is the important complication of APML? APML can lead to DIC, disseminated intravascular coagulation is what you need to remember. DIC, disseminated intravascular coagulation. ATRA, retinoic acid treatment is used for acute promyelocytic leukemia. 1 MCQ sure on the leukemia, doctor. 25-year-old with fever, leukocytosis, increased number of band forms. So increased band forms not always is indicative of myeloid tumor, myeloid cancer, myeloid leukemia. It is also called leukemioid reaction, excessive bands. 25-year-old male with itchy, raised red wheals on his arms and legs after eating shellfish is acute urticaria. 25-year-old jaundice, fatigue, splenomegaly, normocytic anemia, increased retic count. Coombs test negative. That is a very important clue. Fundamentally, hereditary spherocytosis may hemolysis is not because of any autoimmune reaction. It is just because there is an ankyrin spectrin, red cell membrane defect is there. When the RBC is passing through the spleen, it gets broken without any immune system involvement. That's the reason Coombs test is negative is the most important clue to say it is hereditary spherocytosis is what you need to remember. Whatever, we reached 128 clinical case vignettes. I'm telling you, out of these 1,000 clinical case vignettes, at least around 20 to 30 questions will come. I'm going to give you 30,000 clinical case vignettes in the form of 30 ebook PDFs. And all that you need to do revision and master is these 30 ebook PDFs. 25-year-old male with painful genital ulcers, tender inguinal lymphadenopathy. Multiple soft ragged ulcers. It is chancroid. Chancroid is caused by Haemophilus ducreyi is what you need to remember. Right? So, sir, please do these sessions daily. Definitely, doctor. I have no other mission, no other vision. You're all my world. Right? You're all my world. Very good. Safety pin appearance need to be basically remembered. So, doctor, what you need to be topper is 3 to 4 good friends, whatever be their level of subject, but they need to sit with you and you need to have somebody with whom you can cry loudly together. laugh together, and go to the exam and win together, become postgraduates together, consultants together. And one day when you look back, you will say, wow, what a beautiful life it is, right? I still meet a lot of, I had opportunity to almost mentor, inspire 3 lakh medical students and doctors in the last 25 years. Some of them are top consultants today. Some of them are, in fact, my colleagues to whom I refer the case, and they operate day in and day out. Once upon a time, they were all sitting like you, thinking, do we get the seat? We may not get the seat. Competition is like this, competition is like that. But ultimately, they crack the exam. So that's the reason, don't self-doubt. That is first thing. Pehla, you have to believe you are born to be the topper. Then the whole world will follow you. Please remember that. So, doctor, totally, there are almost 1,000 clinical case vignettes are there in the PDF, Sprint 19. So, sit with a friend, download it. You can share that freely to another 4 or 5 of your friends, no problem. But all of you sit together and do the revision of these clinical case vignettes. Imagining the patient in the real scenario, that is the best way to do the revision. Instead of mugging small numerical facts and all that, forget about it. They will all come in the last moment. I mean, they will automatically come to you. But you will lose the game if you're not sure about the common clinical scenarios, how to answer them in the tomorrow's exam, doctor. So, रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके दुनिया को बताएंगे, भाई मेरा नंबर आ गया, right? So, with that hope, let us dream and with full energy. Don't lose your sleep, don't lose your mind, don't compare to anyone, right? Everyone's life is its own complex, is its own simplicity, right? So if you go with that, next 1 week, calm and cool, you are sure to win if you are able to carry your mind, heart, and soul to the exam hall. And pray to God. 25 lakh people, 2.5 million people में आप चुने हुए 70,000-80,000 MBBS doctors है आपके batch में. That means God created you with a purpose to serve the human race, with a meaning to the life. This is just one challenge. You need to take it with a great stride, right? And face the exam with audacity, right? So once more, we will all see you tomorrow, doctor. Don't forget to like this video, comment the video below this, go to the learnograph.com, download the Sprint 19 and do the revision and tell me how you felt better tomorrow when you come back to the Sprint 20 session. Good night, doctor.